But now we'd like to welcome our first guest on the program. We're glad he could spend some time with us today, Dr. Gary Foster, who's Chief Scientific Officer with Weight Watchers. Gary, good morning to you.
Good morning. Nice to be with you.
Yeah, nice to have you with us, and we appreciate you spending the time. I think everyone knows the brand Weight Watchers, Gary, but they might not know what you're doing around the employer segment and for employers and employees. Talk a little bit about that, and then we'll get into diabetes prevention, if you would, please.
Sure. We have a big portion of our business called our Health Solutions business that actually offers a B2B component to our Weight Watchers services. So these are arrangements where either through employers or through healthcare plans, we offer our services, usually at discounted rates and typically with subsidies from employers to make Weight Watchers available. And that comes in a variety of different ways. It could be done by meetings at work. It could be done with our online product, or it could also be done by having employees go to meetings in the community.
That's great. Why should employers be concerned about diabetes prevention, but specifically identifying pre-diabetes conditions?
Well, it's hard to imagine a condition that's more costly, both in terms of the medical and psychosocial cost that is experienced by employees, but also the cost to employers. If you look at whatever metrics you want to use, direct cost, indirect cost, presenteeism, absenteeism, medical claims, all of those things are significantly higher, not just in folks who suffer from obesity, but exponentially high in folks who suffer from diabetes. So the way we view this from an economic point of view is that if we can simultaneously address the problems of obesity and also prevent an extremely costly condition like diabetes, we provide a real value for both employees and employers.
Now, you did a study recently with Indiana University, is that correct? Or
That's right.
Did a study there?
Yeah, a little context first. One is that
Sure.
It's been well established for almost 20 years now in studies all around the globe that a modest amount of weight loss, about 5%, in the first 6 months, actually prevents diabetes dramatically. It reduces the risk of getting diabetes. If you have prediabetes, a small, modest weight loss of 5% will decrease the risk of you getting diabetes by nearly 60%. And that persists at 4 years, and there's recent data that it persists as long as 10 years. So short story is a little bit of weight loss goes a long way. And we know at Weight Watchers we have numerous randomized trials that suggest we can get that magnitude of weight loss. But where this study is different, we actually selected people whom we knew had the diagnosis of prediabetes. So given that there's 83 million people in the country who have prediabetes, we assume a lot of our current members have the condition, but this was a study that definitively tested what's the efficacy of the Weight Watchers program in those who already have prediabetes. And the results were impressive. We got both clinically significant reductions in weight and blood sugar control at both 6 months and 12 months, and the amount of weight loss approximated 6% at 6 months, fully maintained at 12 months. And that was accompanied by significant improvements in blood sugar control. And what's notable about that scientifically is that you would expect people with prediabetes, as they go on the eventual path to diabetes, their blood sugar control would get worse over time. So had we kept it stable, that would be a public health victory. But actually the blood sugar control improved over time. So this is literally, we're bending the curve in the opposite direction. So we're really excited about those findings, and they were published just this month in the American Journal of Public Health.
No, that's great. Ron, I'm sure you have a follow-up for him.
Yeah, Gary, it's Ron Bachman. How you doing today?
Good, Ron. How are you?
I'm doing great. Listen, this is exciting to me because it kind of shows the different directions that consumerism is taking with Weight Watchers getting involved in these kinds of programs and maybe spreading the word around so people are really understanding that you have an employer engagement solution. Some call that sort of an enterprise opportunity, getting employers involved with Weight Watchers. It also tells me that this whole idea of moving from some would call wellness to well-being, that you're talking about the whole person and not just while they're at work, but while they're at home with diet and exercise and things like this. Tell me how it's being accepted by the employer marketplace, and what kind of growth are you seeing, and what are some of the issues to that you might have to overcome in reaching out to employers to help support the Weight Watchers programs that you've got going on here?
Yeah, I think in short it's been received very well by employers, and one of the reasons for that is that we're a company that's not only grounded in science but in consumer insights, and whether that consumer is in the B2C space or in the employer space, we're very intent on listening. And one of the things we hear across both sectors is that employees and employers don't want to just hire a unitary solution. So we can clearly deliver on weight loss, but is weight loss enough? Consumers, employers both want, what about fitness? What about overall eating healthily or eating in a healthy way that's independent of body weight? So our new program is based on that. It's called Beyond the Scale. And to your point about the broader person, it has a food part for sure. It has a fitness part for sure. But we've also introduced last December a fulfillment part. And that allows people to view this process of self-improvement in a very broad, contextual, holistic way. So we're asking people to think about ways they can take care of themselves that don't involve food. Can we teach them non-food coping strategies? And to your point, that pays off not just in the workplace, right? You're not distracted at work because at 3 o'clock you're stressed out and searching for a snack. We've taught people techniques that can take 30 seconds, can take 1 minute, that can calm themselves in the moment or make them more aware. In terms of the growth, we're seeing nice growth in that business, consistent with the trends that we're seeing in other parts of the business. And I think partly it's because of this broad contextual view where employers are feeling I can hire Weight Watchers, again, not just for weight loss, but for a broad variety of things that are important to me as an employer, but also critically important to employees. We have a very well accepted consumer brand, so employers react better to joining the Weight Watchers program, especially in this broader context, than they would to the ABC program, which doesn't have the same brand recognition. In terms of our challenges, I think it's from where we could do better is jointly working with employers to drive engagement. And we have a list of best practices and we see around engagement, and they include working from the top, having the CEO, for example, doing a video, viewing weight management as part of a broader health initiative. So that involves what kind of foods are available in the cafeteria, what kind of opportunities are to be physically active during the day, in ways that might take 1 minute or might be more allocated in different ways, incentives that would drive engagement. So we're pleased with our overall engagement rates, but we can see they can change 2- or 3-fold with the inclusion of these best practices. So that's an area we're focusing on at the moment in collaboration with our employer clients.
Gary, I would make an assumption on engagement, which is a big problem out there, that your experience, your B2C experience helps a lot there too. Your consumer experience helps a lot going back up and helping employers with this engagement. I mean, because that's a big need now, people that really understand how to communicate with that consumer, and your brand recognition.
Yeah, they're really key. I think both. The brand recognition, I think, is well known and accepted and endorsed favorably by employees in the general B2C segment. What we can do in the employer setting is to leverage our consumer insights and, frankly, behavioral science around consumer engagement. There are definitely ways to drive consumer engagement, and that's largely our business, right? We want to not just have people come and sign up for some 8-week or 12-week or 16-week program. We want to engage them over time because obesity is a chronic condition, diabetes, chronic conditions, and just treating them in some acute fixed time interval is not going to have long-term efficacy. And we do different things. We, for example, on our app this past December, just launched a site called Connect, which, think about it as a Facebook, Instagram, but a safe place for people who won't get criticized based on their weight or based on their struggles with weight. It's just caught on like wildfire, and there's something about getting people together who have a similarity of purpose and shared experience. And if you look at the posts there are things about, I had a tough day with my weight, but they also go into other things. I've had a tough day at work. I've had a tough day with my spouse. This isn't psychotherapy by any means, but it's a way that people can share when life gets in the way, and we know that can be a big stumbling block for employees as they try to create a healthier lifestyle. So we're really happy that this is being engaged in so much, and at a pretty significant level. So it's not just here's a picture, here's a comment, and somebody does a like. That certainly happens, but some of our most popular ones have thousands of comments, not just likes. So it's a very sticky way, and it's just one example of how we're getting consumer engagement and continuing to drive that based on technology and based on behavioral science. We know that social support drives outcomes.
As we look at the employer market, we've got a conference coming up in a couple of weeks here in Atlanta. We've got a big wellness footprint at this event, covering a lot of things from this piece to, innovation taking place, digital health, mindfulness, et cetera. And we've got employers leaning forward and looking at ways to do it better. So can you talk specifically about, your message for employers and what you're doing to help them really understand, how, diabetes prevention and wellness programs really link directly to increased productivity with their workforce?
Yeah, I think they do in a variety of ways. One is just pure cost on that side. So again, the data are very clear that people who suffer from obesity and from diabetes have stepwise increases in medical costs. They also have stepwise decreases in productivity and in presenteeism. So the data are very compelling and have been around for decades. And I think our approach has been, if we can look at those two medical conditions, that is obesity and diabetes, and make a difference there, that's going to increase the quality of the employee's experience or life, and it can also then lead to productivity and then ultimately healthcare claim costs. I think the other thing where we provide value in terms of the productivity and the softer measures around employee satisfaction is this broader approach. So if, for lack of a better word, if employers are just hiring Weight Watchers to deliver weight loss, it's still a slam dunk in terms of the increases you'll get in productivity, decreases in absenteeism, and decreased healthcare costs. But if we can also, to your point about mindfulness, if we can teach people skills, and this isn't like an optional part of our program, it's a way that's woven into the program and that consumers are reacting very nicely to. Ways to be mindful, ways to be aware, ways to take care of yourself. So viewing weight management or preventing diabetes as not some punishment, but something positive you're doing. That's where we think we're going to get a lot of value, sort of leading a little bit with weight loss, but then bringing a much broader holistic view that pays off, we think, very well for both employees and employers.
Now, do you partner with other wellness companies, or do you partner with other niche companies, like, let's say, financial wellness, because you actually alluded to that? I mean, if we don't help our employees become financially well or better manage that, it's tough to tell them not to grab that, sausage biscuit in the morning, right? It's hard to do.
Right. Yeah, we're looking. Yeah, given our new strategy of Beyond the Scale into looking at weight loss as one measure of success, but not the only one, we're looking at a variety of different partnerships, and that's certainly one that's been discussed. But when you think about this more broadly, it just opens up a lot of opportunities. So what does membership in Weight Watchers mean? And ways to amplify that and extend that in the months and years to come. And obviously, our partnership with Oprah has given us lots of possibilities in this area, in her role as a board member, in her role as an owner of the company, and most importantly, probably as her role as a member of Weight Watchers and sharing her story with folks as it progresses. So it just gives us a different platform and different opportunities to explore those kind of strategic partnerships.
Gary, it's been great having you on the program. We've got about 30 seconds to a minute to go. I'd like you to leave our audience with any additional things you'd like to leave with, or any parting thoughts, takeaways.
I guess my parting thought would be that Weight Watchers, in some ways, is today what it's always been for over 50 years, as the most credible and well-tested and scientifically based program for weight loss. So that's old news, but it's still relevant. I think what's new news, and I'd like people to walk away with, is that we're expanding that perspective. largely based on consumer insights and also based on science. So even how we approach our points formula has adapted to new science and consumer insights, how we view fitness and how we view this broader fulfillment piece. So we're happy to keep evolving based on science and consumer insights, and I think as we evolve, we're continuing to evolve in ways that make sense for the B2C business, but importantly for employers and employees.
That's great. Hey, Gary, if I'm an employer or even others listening to this program or even the follow-up podcast, how do they find out more about the health solutions part of your business? Can they find that on the WeightWatchers.com site, or where can they find that?
Yeah, that would be the best place to look. Yeah, just WeightWatchers.com.
It's been great having you on the program. Really appreciate you spending time. Enjoy your weekend, and hopefully we'll talk again soon.
My pleasure. Take care.
Thanks, Gary.